Welcome back. This is episode 2 of our interview with Dr. Bush and Dr. Snodgrass. If you didn't catch the first, go ahead and jump back and listen to it. It's a good one and it'll help set you up for this one. But if you did catch the first episode of our interview with Dr. Bush and Dr. Snodgrass, you already know this isn't just about surgery. It's about restoring a sense of safety and possibility after a diagnosis that often leaves parents feeling helpless. In part 2, we pick up where we left off and dive even deeper. What should you ask when choosing a surgeon? What do parents often blame themselves for? And how can we let that go? And what's being done to ensure this kind of expert, heart-led care doesn't end with one generation. This episode is packed with wisdom, validation, and yes, some moments that might bring tears because they brought them to us too. Let's jump back in. Do you have any words of advice on what are some good questions to ask your surgeons? We knew right away that the one that we met with locally was not for us because just the bedside manner, and I actually started to cry and he told me not to do that. And then he said that it's not a big deal. It's no bigger than a circumcision, which we were planning on circumcising. So that was another problem. And then he was like, yeah, we'll just see you when he's 18 months and we'll do one surgery and it'll all be fixed. And I was like, you just told me my son had a really severe case. It's just going to take one simple surgery to fix it. And so what kind of advice do you have as far as what are some good questions to ask?
Well, I'm a huge fan in that, pictures are worth more than 1,000 words.
Yeah.
Right? So if you're interested in reconstructive surgery and you go to a plastic surgeon, whether it's for something that's reconstructive like a birth defect or cosmetic, which is enhancing normal structures, you can go for either one of those. But they all have records, right? Photographs are a huge part of that practice because you want to know this is where things started and this is where they ended up. So I think that somebody who is really meticulous and cares very strongly about their results for reconstructive surgery should have pictures to show, not just of any hypospadias patient, but of a kid that's similar to your son's degree of hypospadias. So that's, one place to start. And if somebody's offended for you asking that question, that's probably not the right fit for you.
That's right. The related to that is just saying how many boys like my boy, how many cases like my boy has, do you fix in a year? And then what are your results? But you can't stop there. You have to go the next step. And if they give you some numbers, some will just say, well, I don't know my exact numbers. But if they give you a number, then the next question is, and how do you know that number? In other words, have they actually reviewed their work themselves? Or really, are you about to find out that they're kind of guesstimating those numbers? We learned, I started a database way back. It's another story that I won't go into detail about, but I started a database that we still keep. So we have a database that we update every single day after every single surgery that we've been doing for 25 years. And we review that frequently, several times a year, because we continue to find a tweak here or a slight change there or something that can improve our results. Mm-hmm. And what the other thing we've learned is that every time we do this, we find that our results could be better, meaning they're not as good as we thought they were when we reviewed it and said, oh, I didn't even know that was happening. That's why we have computer spreadsheets. And so if people aren't going through that mental exercise, that's a concern. And in fact, it might be interesting for your listeners to understand this. It's not just hypospadias. Almost no surgery that you would have done, is it likely the surgeon you visit knows how many times he or she does that operation and what their personal results is, which to me is kind of astounding. and we make our living by doing surgery on people, we ought to know what our results are for the surgeries that we do. So that's something. And like you said, if they get offended by, or you sense some tenseness from asking that, then maybe you should step away and go, well, why would they be upset for me asking? I mean, we get asked that.
Mhm.
I mean, people say to me, well, how about my son? How often do you do that? And I said, this week or in a year? Yeah.
But you'd be surprised at how many surgeons are quoting you our data that they
Yeah.
published, and they have no idea truly what their
numbers are.
own personal numbers are. So the best kind of spread that we know of in terms of results for hypospadias probably came from a study that's been published recently from the Netherlands, where as a nation, they decided that they were going to put boys into a database where there were definitions for the outcomes that they were looking for. I helped them set that up many years ago. And not only were there specific definitions for what a complication was and what a complication, wasn't, but they also had photographs that then went into this database that then had a committee that reviewed over all of those. So this really was probably the best well-done study to have an understanding of what are the results of hypospadias by a group of surgeons in a location, in this case, the country of the Netherlands. And what they found was that for distal hypospadias, that's all they've looked at so far. They haven't gone to proximal hypospadias, but for distal hypospadias, the success rates ranged from 95%, which is a great success rate, to 60%, which means the complications amongst surgeons were anywhere from 5% to over 40%. Wow. It's a huge spread. And the overall complication rate was 17%. So it's a big difference as a parent going into a surgery thinking that there's a 95% success rate to all of a sudden that there's only an 83% success rate. Like those numbers are different. And yet there was this big spread of things. And so some surgeons had great results, some didn't. You don't, as a parent, know how to negotiate that. And most surgeons don't have any idea. I guarantee you the surgeons with the 40+% success rates had no idea. Yeah.
But and these weren't just people out in the community. These are at their major medical centers. These are the professors teaching other doctors how to do it, which is kind of frightening. And so, what that emphasizes is you have to do some homework, because even the minor hypospadias, a term we never use, can have a high complication rate. So unfortunately, it's buyer beware in this case, because you can't, there's not published statistics or anything on individual people, but you can ask that. And if a doctor has no idea how often they do it and what their results are, and they just tell you, well, yeah, I haven't seen a fistula in 2 years, but that's not data. That's just,
Right.
Yeah. So.
Well, and then I can only assume that data gets even more skewed because of the different techniques that are there to do it. I know that with our first consult, they were talking one surgery, and it was a hard decision for us to say, we'll go with you guys and do this 3 times when somebody's telling us it's going to work after one. But
we should say
it was clear to us. It was obvious, but that's still a decision to make.
It is. And we should make clear to people listening, your son had a severe hypospadias,
Right.
Yes.
and we used to fix those in a 2-stage repair. I was trained to do it in 1 stage, and I gave that up really fast.
Yeah.
And
Everybody had complications.
yeah, everybody.
Which is what the published data shows, that for severe hypospadias, and you try it in a 1-stage,
You're not done.
all of those have more and more and more
Yeah.
surgery after that.
And so then we did 2-stage repairs for a long time until just a few years ago. And then once again, looking at our database and analyzing things, doing measurements of things in the operating room and all of this, accumulating information and then putting it in a computer and analyzing it, we found that our results from a 2-stage repair needed to be better. And we found out that if we just made one change to make it into 3 operations, that that was a game changer. So our patients now have better results, better appearance, better functional results, everything, fewer complications than has ever happened, in the history of hypospadias surgery for severe hypospadias. But the majority of boys born with hypospadias don't need that, and they can be fixed in a single operation. The whole key is the main thing that decides that is not what they're going to be told in their consultations. The doctor's going to look at where the opening is and say, oh, that's a less severe or more severe hypospadias. But it's really the bending of the penis. It's the curvature of the penis that decides. If you have no bending or a little bit of bending, then that's a one-step operation. But as soon as you get over 30 degrees, which is not much. I mean, some of these boys are bent like that.
Yeah.
Then that's what makes it more complicated. And those are the patients who need multiple surgeries.
It's just like, say, with breast cancer.
Yeah.
You don't go in and have a mastectomy and have all of the reconstructive muscles moved around and put an implant and make a nipple all at once. Like you that's just too much for the body. Mm-hmm. You do one piece and you let the body heal, and then you come back and you do the next step and you let the body heal. And it's just a process that I think over time has gotten better and better and better, so that now you can have an expectation typically of having a pretty normal aesthetic, even in the setting of cancer. And that's the whole goal for even the most severe forms of hypospadias. By doing things in a stepwise, controlled fashion, you want to have the most normal aesthetic that there is. And I could certainly make the argument that for a boy who's going to live the entire rest of his life and has to urinate through that, which you happen to do a few times every single day your entire life, and then use it for, pleasure and things that people use their penis for later on. I mean, that's a really important consideration for things that you want to look and function as normally as possible. And we shouldn't just reserve that for folks just, that have cancer. I mean, it should be for all sorts of reconstructive surgery that we want those best outcomes.
That's right. I'll just amplify that to say that when we're talking to parents, in particular, because A, you didn't want your son to have a birth defect, and B, you don't really have too much excitement about the thought of him having surgery, and C, if it's a severe case, he's going to need more than one surgery, then that's concerning. And so nobody wants that. But so we encourage parents to change their perspective a little bit. And instead of looking at their cute little baby and their heartstrings are tugging and all of that, to say one of these days, that little cute baby's going to be 16 years old and come walking in the door. And when he comes in at that age, he wants to have a normal penis. And he doesn't care if it took one operation or 4 operations. He wants to be normal. And if he's not, he's going to be upset and concerned about that, especially if, the parents just said, this is too much for us to handle. We can't deal with this. So that's part of the thing, is that you didn't ask for it. It's a journey to get it fixed, but it can be repaired to work and look normal. And that should be the goal. You shouldn't see a surgeon. That's another thing we could say. If your son has severe hypospadias, many surgeons are advising you, don't get too hung up on us making it look normal. Maybe the opening's going to be, lower. Maybe there's still going to be some bending. Don't expect us to make this look, like some other boys would, because look how severe it is when he was born. And again, that's just not the right answer. Every boy wants to grow into a man with a normal penis, and surgeons who do this surgery should have that as their goal.
We absolutely that answer.
Yeah, I was like, wow, if you guys would have told us that, I think we probably would have decided not to do surgery. Like if we were coming to the experts and they were saying, well, it's a bad case, like don't expect it to be that great. I'm like, well, I think we just may leave it how it is.
No, that's burnt into my mind. As the first urologist we saw, so I asked, how good can we expect the outcome? I don't remember the exact terminology, but he says, well, good is the the worst enemy to perfection or something.
Yeah.
And I was,
perfect is the enemy of good. We'll just make it good.
right. And I was like,
Good means
that's
not
not wanting
fix.
yeah, we didn't want anything to do with that. We wanted somebody that said we're going to get perfect or very, very close to it. And that's what we were looking for.
Yep, for sure. I have a question. I'm just like super interested to know what's the future of the clinic. I mean, I don't know if you guys have experienced this with other parents before, but like there is also a stress on my heart that like something bad would happen to you guys and then no one would be able to speak with our son. And I sat with that for 18 months until we were done. And then I'm like, okay, not that I want anything bad to happen, but I was like, oh, okay, like we made it through. So, there are some like thoughts in caregivers' heads of like, you guys hold this like amazing ability and have this great space. And how do we get more people doing it?
That was a huge stress on us too, because I mean, we have so much knowledge that has been gained over the course of the 10 years of this practice. And it has become increasingly clear to us that, if something happened to him, if something happened to me, like that knowledge can't end. Right. So most surgeons, most doctors don't think of their succession planning, but we have been thinking about it and planning for it for a very long time. And so we've already started that process. We have our first apprentice surgeon here. So these are fully trained surgeons, but now they're starting the Hypospadias training, which is different than their many, many, many years of pediatric urology training. Oh. And so the plan for us is basically as soon as possible in the next few years to have not just one, but two, so that we have another surgical team that's working just as much as we are. And not only are they working just as much, but we're verifying that their results are just as good as ours are. And that's easy to do with data and pictures and things along those lines. So, we first of all have to get another team ready to go. And then by, the time that gets, done, probably Dr. Snodgrass one of these years will want to retire. And so then we'll get a third surgeon.
Just make clear.
One of these years.
I remember somebody told me the other day, well, we heard he's retiring. And it's like, well, nobody told me. So.
See, they're like making it up in their brain because they're so worried.
Yeah. But then we'll, have another surgeon, so that basically at all times our plan is to have at minimum 2 surgical teams that will be working. And if we need a third surgical team, then that will happen. And then he and I have really been talking a lot about kind of the legacy and really what happens around the world. Can we find basically core centers where surgeons can truly concentrate on doing this day in and day out, because it's just something that needs to happen, especially for redos, especially for more severe, for distals that have a lot of curvature. I mean, there are so many technical steps, so many nuances to how the skin needs to be configured that's what needs to happen. There need to be pockets. It's not that everybody should dabble because they feel like it. And frankly, we've heard too many times surgeons just say, well, I don't want to give it up because it's fun surgery. Well, guess what? It's not about what you want.
It's not your entertainment.
Right. It's about what this person is going to have to live with for the rest of their lives. And so that is all on the agenda, and we've got very specific plans in place for all of that. So we are working to make sure that you don't have to come to me, you don't have to come to Dr. Snodgrass. You can come to this place that will keep that knowledge set going
and expertise
as long as you can foresee in the future, because it's such an important issue.
Yeah, for sure. Well, I love hearing that. That's very great. I feel like I can see the passion in it too, which is obviously the reason that you guys do what you do. And that's just so good to see from other medical professionals and people that are working on, I mean, I know you guys work on adults too, but young children. And it's just, it's good to keep that
Well, it was our goal to basically find somebody as obsessed with hypospadias as we are. I mean, we want team members that, all of our nurses who are here, all of the people who, they love doing what they're doing. They love making the impact that we make on people's lives. It makes us feel good to have families that are appreciative of us, et cetera. And that's what you go into medicine for. And for some folks, they like to dabble in everything and they like to do all sorts of stuff. But for us, we made a conscious choice to give up everything else to just do this because we think it's so important. And there are other surgeons out there. And then it's just a matter of providing them with the tools and the knowledge and the repetitive nature of doing it over and over and over again, so that basically no matter what there is, we could say, yep, we've seen that. We've done that before. Here's the best way to deal with it that we know.
Yeah. Yeah. I love that. If I was in a different medical field, I would be like, let me go back to school. But chiropractic is very different than what you guys do. So I will not be going back to school. We'll just support your mission from afar. Yeah, I mean, I think, do you have any other questions? I just want to, if not, or if there's anything more that you think should be known, definitely share, but we can also wrap up with just like what's some important messages to share with parents who maybe are feeling scared or overwhelmed. I mean, right, that's that first step of like, it's almost too much to handle. So if you have any words of advice there, and then we'll wrap it up.
Well, I don't know that I can answer that question from the standpoint that there are parents, of course, who don't contact us or talk to us, and there are some people who just go into a shell and just don't. They just close this off and say, "I'm not going to deal with this." I'm sure, but if we certainly have people who contact us with a mixed feeling about it, they're not sure they really want to do anything, and they've heard about the bad outcomes that can occur, or the questions whether it's optimal to do this in a child before, they grow up, et cetera, et cetera. And our response to that is, well, just talk to us about it. We're happy to talk about what concerns and all you have. I mean, there's just almost nothing in this field that we haven't researched and written an article about, and that includes these questions about parents' viewpoints and concerns and all that. We've written on those subjects too, which is just to say that we hear that, we understand it, we talk to people about it, and that's part of it. Ultimately, the choices are up to the parents. Our goal is to give you the tools and the information to make those decisions. And
I'm going to take that one step further and say, it's, we have the tools and information that we know as surgeons who repair this. But there are many folks who need aspects that we don't provide, like therapy, for instance. For all the teens and the adults that we see, we are right on the cusp and of making it mandatory that they chat with a therapist before they come. And I tell families, if you're of course, it's natural to feel stress when you have a baby in general, that's stressful, much less to have a baby with a birth difference that you've never heard of. And it's in such an important part, et cetera. So, we think that's such a big issue. We have several therapists that work with our practice, but it doesn't have to be one of those. It just needs to be somebody, because when you internalize all that stress as a parent, that's going to come out, and your baby can sometimes pick up on those sorts of things. So, hypospadias doesn't just affect the person that it affects. It affects the whole family. It affects siblings. You might have to travel to Texas and, all of them. And so really, you spoke of holistic medicine, making sure that your mental health is taken care of is an important aspect of things too.
And did you hear us say that for teens and adults that we basically are requiring them to do that? Now, some of these are people that have never had surgery, for example. So when going back to that question of should people wait to deal with this? And that gives you the answer. I mean, those people are so confused. The the boys are so confused and distraught and emotional. I mean,
we've seen them really lash out at their
parents. It's terrible because, who do they talk to? If you have, say, a boy doesn't have surgery or wasn't done right and the parents just gave up and said, we're not going to do anything else about that. The problem is, once they recognize that they're different from the other people, who do they talk to? I mean, they're not going to talk to their friends. I mean, your husband can tell you the locker room is not the place you share. Yeah. And they won't have a girlfriend
because they're nervous about what happens if they
become intimate and they look at it and go, what's the matter with your penis? Yep. And the last people on earth they want to talk to are mom and dad about it. And so they isolate themselves and they suffer with it. And then finally it reaches the point where they finally go into the folks and say, I just got to talk to you about it. And then they're incredibly embarrassed and all about it. It's a whole bad situation and nobody should go through. I mean, nobody should go through that. So, yeah. So the hypospadias is a really important thing because the penis is the definition of manhood, right? I mean, it's the image of it. And it affects not just the guy, but also, the people that are important in his life, including his future life with intimacy and all of that. And that's why I say everyone wants to have a normal penis because there's so much of your life is connected to that.
Yeah. Even if you don't want a normal penis yourself, you probably want people in your life that have them, right?
Fair enough.
Right.
It's a thought.
I'll be clear.
Yeah, for sure. And I can imagine one of the reasons we made the decision we did is because I could wrap my brain around the mental load that would be brought upon our son if we let him choose later in life. And for us, we wanted to absorb that, right? We didn't want to have to go down that path. I felt like it was easier for us, again, to explain what had happened and this is what we decided versus having to be inside that space and have just the healing with, older tissue and also healing with your friends and your activities around and that you're different. And for, we just wanted to absorb that. So I do also love that you guys are providing those resources to your patients because that mental health aspect is huge for sure. So, yeah. Is there any way that you would like to tell people on how to connect with you guys? I know you have your website. You
can certainly check out our website. It's www.hypospadias.com. It's HYPOSPADIAS. Sometimes that's often spelled with U, but it's as.com. For those who really are into the technical aspect, we have a YouTube channel. So we have a surprising number of parents that like to watch
those videos.
You don't have to. I don't know that I would have recommended
We
that.
made those for surgeons to help them, but not a parent.
I watched them when I was doing my research. But that's out there. And we actually have non-surgical videos on there too. We have webinars, some of which are for parent level, some of which are for surgeon level, but they talk about, what is chordee and how do we correct curvature and what are some of the technical, details of things. So that's a tool as well that people have. And then really, as part of our growth program, we really, really are hopeful that Operation Happenis, penis is something that we can get more active again. We were starting there, and then COVID hit, and so that is kind of it's had some waves, but it's really a big priority for us over the course of the next couple of years, so that there's a better social network that's out there and an education component of things. And we have lots of really fun stuff planned with that. So if any of your listeners are interested in becoming part of that, for sure, reach out to us because that's an important component on the horizon.
Yeah, great. That all sounds awesome. It's a great way to connect. And you have any last words?
Yeah, we'll put the links all below in the show notes for anyone who's interested in that. And no, I don't have anything else to add right now.
Yeah, I think it's as simple as just starting with a reach out and a teleconference with you guys. I mean, that's how we did it, and it definitely changed our world. So obviously, we're very grateful for the space that you have and that you provide, and you guys make it easy. I mean, you guys are very down to earth, and you care about, even though we had never met on that first call, besides on the call, it felt like you cared about what our son was going through, which was the most important thing as a caregiver, trying to determine who is the right person to operate on such a sensitive part of our son's body. So
We're glad we could help.
yeah, thank you. And thank you for your time today too. We appreciate it.
You're welcome. Have a great day.
You guys too. Thank you.
If you're like us, you may need to sit with this one for a bit. This episode covered so much, from clinical truth to emotional healing, from data to dignity. And what stands out most is this: healing happens when you're seen, when you're believed, and when you're led by people who care. To Dr. Bush and Dr. Snodgrass, thank you for showing us what's possible. To our listeners, whether you're in the thick of it or just beginning to explore what's right for your child, know this: you are your child's greatest advocate. You are not alone, and yes, you were born for this. We'll be back next episode with a new story, a new voice, and another reminder that community and support is everything.